Right, I'm Matt Joint. I'm the Chief People Officer at Frimley Health Foundation Trust. I'm 59. I'm now in my 60th year. So roughly 10 years ago, I was pretty fit. I've been doing a lot of exercise. In fact, I've just ridden down to Paris in a day with a group of friends, and I had a routine checkup, and I checked out pretty well, except for one thing. My blood pressure was something like 225 over 135. Complete surprise to me. They seemed quite shocked there at the clinic. I was told to go to my GP immediately, not to run, not to cycle, and I was then put on some drugs. And over time, that totally stabilised my blood pressure. It's now completely normal and has been for almost 10 years. So I was told once I got the diagnosis, I was potentially 6 months away from something very serious indeed, most likely a stroke. So I was lucky. I was extremely lucky to have been diagnosed when I was. I laugh about it now, but when I went home after getting the diagnosis, I rang up my mum and said, "It's really high blood pressure." And she said, "Well, of course, your father and I have both been on blood pressure tablets since we were in our 30s. And I have a son and two daughters. I've told all three of them exactly what happened and what I did about it. I'm probably a little bit paranoid these days about making sure they keep an eye on things, but I think it's worth the risk. They can deal with my paranoia if it's going to keep them healthy. It's really easy to get a blood pressure check. It's not invasive, it's not painful. Yet I wasn't thinking about that at all. I think very differently now. I think living with high blood pressure, or what actually becomes normal blood pressure because you treat it, is very, very straightforward. Okay, I have to take a couple of tablets a day, but to be perfectly honest, I feel great. It's worked wonderfully. It's not just I'm alive; I actually feel good. So here I am in my 60th year, feeling fitter and healthier than I did 10 years ago, and possibly better than I did 20 years ago. So I'm pretty positive about the whole experience as long as people take action. I took the action I needed to. I left it too late. I wish I'd got there earlier, but at least I did something about it in the end, and it's good for me now.